All right, in this video, we're going to demonstrate a series of exercises that we call sitting track that we do on the exercise ball. Again, we have Rachel, our wonderful model, as I can't talk. Okay, Dr. Tolman, you talk her through sitting track and we'll help our patients understand this one.
Okay, to start out, you make sure that you're stable on the ball. If you have any instability, put things around the ball to keep it from causing you to roll away or get ejected into furniture.
Yeah, that would be bad.
It's the only time we see problems with this. So we're going to start out with pelvic tilts as a warm-up, and you can do 10 to 20 pelvic tilts as your warm-up, and that gets the juices flowing, gets circulation to the lower back. This is primarily for people who have loss of core stability.
Okay.
They're getting their core back. This is a mobilization technique to start working on core.
So you're tightening that core as you come forward.
We're
you're
pulling that tummy in
core.
really strong.
Okay.
It's almost like we're lifting ourselves up as we tuck our bottom in, and that really helps to stimulate that core.
Okay.
The transverse abdominis, where her hand is touching, is the most important part of this exercise. So after doing 10 to 20 of those, we're going to have her now do lateral tilts.
Perfect.
The lateral tilts aren't as important neurologically, but it's good for circulation and helping with a little bit of this muscle control for the following exercise.
Okay. And they feel really good.
And you can do a few of these. You can do a bunch of them. Like I said, it's not as important for core, but this next exercise is going to be rotation. So we're going to do the rotation on the ball, and this incorporates the pelvic tilt, that thrust. With the lateral tilts, you're using a lot of intrinsic muscles of the spine.
Okay.
Your glutes are fired up a lot, but you'll feel that tummy pull really strong every time you thrust forward and roll that. You're getting your obliques involved, which is really good for life motion because our spine twists as we walk and as we move.
So this is a core exercise as much as anything. You're really pulling that in. Right? You feeling it? Okay, good. Good. All right. And then make sure you go both directions. Yeah. So make sure the same amount of time in each direction. Perfect. That looks great, Rach.
And Rachel's doing this after having 2 kids, and she's doing wonderful. She's
she's working hard.
Yeah, she's
get herself back into it. Yep, I love that. Okay, we want to move on to the next one.
All right, so the next exercise is we're going to walk down into a bridge position. So your back is on the ball, your legs out forward, your feet are right underneath your knees, and your head's resting on the ball. And you can even pull that chin in, and then we're going to walk back up. We're going to have her do this a few times. Watch the way that she's pulling her tummy in and keeping a bridge position where she's thrusting up towards the ceiling.
You kind of can't see it from here, but her head is resting on the ball, right? At the bottom. There you go. You want to do one in that position? Then we can see the side. So her head and shoulders come down.
So the proper bridge position is that pelvis is thrusted. You're using your glutes, you use your lower abdominals, and of course your quads. This is a really good exercise to help for low back stability.
But how many should they be doing of these bridge and back?
If you're comfortable doing 10, up to 30 of reps.
3 sets. So 3 sets of 10 if you can. 1 set of 10 is great too. Right?
And you can advance to 3 sets of 30.
Okay. Okay, perfect. And that's a good way to end it. All right. Anything else in this series, or is that about it?
That's great. Thanks.
Okay. Thanks, Rach.